Now, all of us have specific areas in our body where we feel like there are some pouches of fat or a certain fat that we can't get rid of. We're switching gears a little bit to targeted painless laser fat sculpting. What is this precisely?
Well, it's non-surgical. It's relatively new technology, though it's been around for several years, and it's painless and relatively risk-free. I don't think it's a replacement for liposuction. So what I explain to my patients is if they have an area of padding beneath the skin, not inside their belly cavity, but beneath the skin, I could probably reduce that padding by about 80% with liposuction. But with these laser diodes, painlessly, no surgery, just several absolutely painless treatments they generally sleep through or do email through. I can probably reduce the thickness of their fat pad by anywhere from 25 to maybe 60%. And as long as people are willing to spend the time and watch their diet and realize that they're partly responsible to keep the weight off and try to lose weight by exercise, they can get a nice improvement without having to go underneath the knife.
Interesting. So what's actually happening during this procedure? Is it similar to the type of, we've heard about cool sculpting, applying cold temperatures to that layer of fat. Is it similar to that action or different?
It's actually quite different from that. And I think it's more effective and it's not painful. And I think the results with the diode laser treatments are better. The two machines that I use are the iLipo machine and the Zerona machine, both of which most of our viewers have probably heard about. Both use a red diode laser technology, low power, so you can even burn yourself with it as long as you don't look directly into the beam for a long period of time. It's relatively harmless. And what has been found to happen is it mimics your body's call to mobilize triglycerides as an energy source when you're exercising. So the mitochondria get touched by about 40 photons of light, which is nothing. They stimulate something to change in the cytoplasm of the cell. The pH changes. And little pores open up in the cell wall. The body dissolves the triglycerides into free fatty acids, and they come out. And they're there for you to burn up, or they may go back into the cell. So I encourage my patients not to eat around the time of the treatment, to drink a lot of fluids to help the lymphatic system pick up those free fatty acids, and to exercise to try to burn a couple of hundred calories in the first couple of hours to give the best outcome. And I've had patients lose 4.5 inches, and I'm sure others will lose even more. I myself lost about 1.5 inches in circumference of my trunk. And in my case, I think the fat reduction was about 60%. Wow. But I'm not sure everybody achieves that degree of improvement. But it's painless, it's safe. It's been shown that if you combine targeted laser treatments of this nature, external laser, with diet and exercise, patients get 5 times as much loss of circumference than if they don't add the laser to the diet and exercise regimen. So it's pretty impressive.
That's very significant. And then how often would one have to go in for treatments, or what's the course of treatment for this?
The natural course of treatment with one machine, the iLipo machine, is 20-minute treatments twice a week for a month, so about 8 treatments. Sometimes we extend it to 10 treatments, depending upon the size of the patient. And with the Zerona machine, it's 3 40-minute treatments for anywhere from 6 to 12 treatments, preferably 12 treatments. And people lie on the table. It's absolutely painless. It's so easy. But again, if you go home and have a nice fatty meal and you don't exercise and you're not drinking a lot of water, the results will be limited. So we encourage them to take the right steps and to try to lose weight. Interestingly, when you lose inches, you don't lose that much weight with the laser treatment. It's the cell wall that carries most of the fat cells' weight, not the fat contents themselves. So you lose inches without losing a lot of pounds. But if you contribute to the treatment by dieting and exercising, you can really multiply the potential benefit.